right, so being a Tuesday, guys, I'm sure you had a fifth voice, and that is none other than Dr. Chris Amina. We are talking stroke today, and so we're just going to get right into the conversation. Hello, Doc.
Hi, good morning to our
Good morning. Hey, Doc, your energy is low.
Yeah.
Should we diagnose you? Should we diagnose you? Doc.
So
what is going on?
So we're talking about stroke.
Energy. Oh, is it your exam that's draining you?
Yeah.
Right.
Oh, yeah. She diagnosed you.
Yeah, it just clicked that, yes, probably that.
So what are we talking about again?
Stroke.
There's not dig ground though. Charlie.
The exam distress.
You don't dig ground, Charlie.
Is
the exam going to
give you a stroke?
No.
No.
Forbid that.
So when we talk about stroke, it's been happening a lot to people these days of a certain age and criteria. But so today we're discussing the science and how to identify it and know whether you are at risk of getting it, and also how to manage it and when to call for help and all that. Now, in order to understand stroke, the basic understanding of stroke is loss of blood supply to parts of your brain. Basically,
are there types of stroke?
Yeah, there are types. So you can have blood supply in the blood vessels being blocked. So you have like something preventing blood from reaching your brain, right? So it's not enough that is reaching your brain. Then you can have it rupturing. The block is so bad that it ruptures, and then the blood drains into your brain, right? Then another part is the third one, which is usually a slightly minimal one, is usually people get it before they get the severity of stroke. So it's sort of like a precursor to stroke itself.
Is that what we call mild stroke? Because some people say mild stroke.
No, it's
notification.
Transient ischemic attack.
Sorry?
So it's transient ischemic attack. Yeah, so that one is a mini stroke. We call it a mini stroke. So it's temporary.
But does it always lead to a big stroke?
Yeah, it's a precursor. So it might come, you recover after a day. It might not come for a while.
But if you know, say it will come.
So it means that you are at risk.
Wow.
When it comes. So
there's no having a smaller or a mini stroke.
Yeah, you can.
And then you recover and you don't
get it.
Yeah, that's if you get treatment and you do all those changes that you need to do. Right.
Okay.
So lifestyle modifications, medication, exercise, and all that will maybe prevent you from reaching the other end. So it's basically like a warning sign for future strokes.
Okay.
Right. Okay. So if you interrupt blood supply to the brain, it means cells are going to die. Brain cells are going to die. If you reduce the amount of blood that's reaching the brain, they are going to die, but maybe at a slower rate, right? And then you have ischemic stroke being caused by a blockage or a clot. Let's use a clot in the blood vessel. So a clot forms in the blood vessel, prevents blood from reaching there. Then you have hemorrhagic stroke, which is caused by bleeding into the brain. So you have someone has a brain bleed. So blood vessels have ruptured and it's causing the blood to bleed.
So when there is blood not being moved to the brain, that causes stroke. And when there is an overly amount of blood, is that what you're saying?
No, not overly. It has ruptured. So now it's not in the pipeline anymore. It's not in the pipeline anymore.
Bleeding into the brain.
Oh, okay.
So it's like use it for easy, an easier way for people to understand is like the pipeline that comes to your house that supplies maybe a neighborhood.
Okay.
And then somebody actually maybe built on it, so a car passes on the pipeline. Though you get water, you won't get at the rate at which you were getting previously. So that's the first one.
So once there's an imbalance.
Yes. So the second one is now the car actually rolls over and bursts the pipe. So the water is all over your road and everything.
Okay.
Right. So those are the two.
So once it's not happening at the normal rates, both can lead to a stroke.
Exactly.
Okay, I get that.
Now, so
there are balance of blood in the brain.
Yes.
Doc, we have your video ready. So
okay, so we cue the video. Yes. So let's do that now.
Oh, since I've talked about it. Okay.
A stroke occurs when the blood supply to the brain is blocked or reduced. That can happen because of either a blood clot that breaks off and goes to the brain, or sometimes there's a narrowing in one of the arteries that supplies blood to the brain. In some cases, bleeding in the brain also causes a stroke. But anything where you have interrupted blood supply to the brain can cause a stroke. When a stroke happens, some of the brain tissue dies. How much of the brain tissue depends on how severe the stroke is. Rapidly seeking medical attention is critical. A stroke is sometimes called a brain attack, which, like a heart attack, is always a medical emergency. There are two common types of stroke. One of these types is called hemorrhagic stroke and occurs when a weakened blood vessel ruptures in or near the brain, leaking blood into the brain and causing the brain cells to die. The second, more common type of stroke is called ischemic stroke. It occurs when a blood vessel, an artery carrying blood to the brain, becomes blocked. Without blood supply, brain cells deprived of oxygen and nutrients can start to die within a few minutes. Ischemic strokes can have thrombotic or embolic causes. Thrombotic strokes are caused by a blood clot, medically termed a thrombus, in an artery supplying blood to the brain. Blood clots usually form in arteries affected by atherosclerosis, the buildup of hardened plaques on the inner walls of arteries. If an atherosclerotic plaque is disrupted, a thrombus forms on top of it and blocks the vessel, stopping the flow of blood. In an embolic stroke, a blood clot, called an embolus, forms somewhere else in the body and travels via the bloodstream to the brain. Eventually, the clot reaches an artery small enough to block its passage. It lodges there, obstructing the blood flow and causing a stroke. A stroke is always a medical emergency. That's why it is important to recognize the signs of a stroke and take emergency action as quickly as possible.
Doc, how do we recognize the signs of a stroke?
So there are early warning signs, and we use the abbreviation B fast. BE fast. So
okay.
BEFAST. B
So
fast.
can you
So
break that
your
down
B
for
will be your balance. If you realize that you are walking and the person is holding the wall, can't walk straight, and there's no alcohol related. Yes, it could be the first one. Then the E is your eye. So you realize that your eye starts twitching, or you can't see in one eye.
Okay.
So there's vision loss in one eye or both, or you say it's blurry, your vision is getting blurred and all that.
Would that include uncontrolled eye movement?
Uncontrolled eye movements are also part. So you can't, the person's twitching, the eye is just, yes, that's one. Then you go to, so that's BE, then you go to the F. So F is face droopiness. So realize that when you smile, that one side of the face is falling apart. You can't control the facial muscles, yes. Then you go to arm. Now the arm one is the easiest one because all you have to do is try and raise both arms together like this. You realize that the person, one arm will be falling away.
Yo.
Yes.
Is there a number of minutes or seconds? That
No, even as soon as
these are precursors.
These are precursors. So as soon as you arm weakness, so as soon as you lift your arm like this, rather than one arm is numb, one starts falling because there's not enough power in it. Then the other one is we are speech. So speech disability, speech difficulty. So either they can't understand what you are saying, or they have slurred speech, or they are speaking gibberish. So they are really trying to say something like hello. They might be saying something else totally. So there's this disconnect. Then the last part is time. As soon as you get to T, you know it's time to call for help. So time represents time to call 911 if you're outside.
Is that when you've experienced the B fast?
So when you start seeing the B, E, then you know you're on your way.
Okay.
Because as soon as balance comes in, it means that you can't even walk towards where you're going. So you probably sit.
Okay.
Your eye, you start
So balance, eye, face,
arms,
and then speech,
yes.
and then time.
Time, yes.
Okay. So for time as well, I'm interested in how long it has taken for some people being a doctor. What are some of the cases that people have taken so long before coming to the hospital to know that it's a stroke?
Yeah, so what we have, either the first one you have is the patient himself saying that has happened before, and therefore it's fine, it's going to be fine, so let me just take my medicine. There's that one. Some patients don't like hospitals,
right? Yeah,
some adults especially don't want anything to do with the hospital.
There's one sitting beside you.
There's two people sitting beside him.
Yeah, so
there are people who don't go to. So that's the first one, is the will of the patient, and the second one is the caregiver, the primary care person, the person who found the person in that state. The third part that we have issue with in this country is transportation or proximity to a health facility.
Right.
And the fourth thing is the health facility having the ability to recognize these things and then make an intervention
fast enough
to bring you back. Do you understand how this works? Yeah. So these factors. Another thing that we start facing is that the person having a very good eyewitness. You can have somebody who came with a patient and saying, "Oh, wait, there's not here." You know, the person not giving you enough information about like the person. That does this happen before? Is in the family? Has anybody in the family has it before? Has the person? You know, those kind of questions that will help you understand what is really going on. The person on hypertensive medication. No, that's what make us jump into the risk factors. Now, when you talk about risk factors, who is at risk?
Because you mentioned medication,
right.
Are there some side effects of certain medications that can cause a stroke?
Yeah, there are certain medications. Every medication that we take has a side effect. We, unfortunately, for our part of, we don't read the label.
Yeah.
So as long as it, that's why sometimes certain medication will tell you if symptoms persist, consult a doctor. If you are not seeing any changes, consult a doctor. If you see this and see this kind of symptom of your drug or side effect of your drug, let us know. If you start seeing dizziness, headaches, I mean, there's some pain medication if I take, it's actually worse. I feel more pain and headaches for taking that pain medication. I didn't know that until I took one. I realized that this was actually the problem. So in that case, I know that this, but I also didn't read the label.
For you. Yeah.
Right.
Was this before you became a doctor?
Yes, that was before.
Okay. Because naturally, as a doctor, you read the label.
Yeah, you read the label.
Yeah.
Usually, we take the paper out and read the whole thing.
That's what I'm asking.
But when you go back to talk about, someone will ask you who is at risk of these things, apart from somebody who's taking medication. You can talk about. So there are two things that we do. We do this where the risk factors, there are two. One is modifiable. It means you can make changes, and then one, you have no control over it. So if you do the modifiable, if I ask you one modifiable risk factor, high blood pressure is one.
Okay, that's something you can work on.
You can work on, because you can take medications, you can take, then you can talk about diabetes is one. Then you can talk about smoking, high cholesterol, obesity, physical inactivity. You can talk about heart disease such as atrial fibrillation. That's the person I can hear my heart flat. Yeah, then you can excessive alcohol consumption. Then you can have somebody have drug use like cocaine and methamphetamines, meth. So then you go to your non-modifiable. You can't do anything about age. If you are, the risk increases with age.
Okay.
Right.
So the older you're getting, you have high risk of stroke. Then you have a family history of stroke.
Doc, with the age, so is that to say that with the age one, I was going to ask, some young people as well, you'd hear stories of them having a stroke. Would that be because they've had a family history?
So so they can either be the family history of it or a modifiable risk factor.
Okay.
So when you're young, like we focus more on after asking a question about is there someone in the family who has it before, then we jump.
Are you drinking too much?
Exercise? How many bottles a day? Like, are you a social drinker? Do you smoke? Do you take hard drugs? Your work, is it something that you sit a lot? You don't move around? When the last time you exercised? All those things, right? So then it helps you understand that, but it's a good question in the sense that right now we are seeing a lot of conditions that when I was in school, when we were growing up, we knew that these conditions were mainly for people who were older.
For older people, yeah.
Like diabetes, for example. Now we are seeing it in very young people. We have child diabetes now. We have lives, people actually, some people are there, their family doesn't have diabetes, no history of it, but they are getting it because maybe the diet, the lack of exercise, all this, something modifiable risk factors that they are doing is causing them to have diabetes. Right, so imagine a family history of no diabetes and somebody has brought it in.
So it will start from them.
Exactly. So if the person also doesn't train the child or change the child's diet, that's why we appreciate parents who change their child's diet and not say that maybe also an EFE. Yes, you get it. We like, there's nothing wrong with letting your child being fit, and not to say anything on that regard. There are children who genetically will become big because of family history, and there are who are naturally slim because of natural. But that doesn't mean that you shouldn't watch it.
Yeah, Doc, I'm also assuming that the fact that it is prevalent in young people right now means it's modifiable.
Yes, it is.
So we are causing it.
Yes, we are. Yeah, we are like our
the accelerated lifestyle.
Yes. Yeah. So the next one is a previous stroke or ischemic attack.
So if you've had it before.
If you've had it before, yes. Let's say that if you had it before, then there's chance that you also, and then
how high is that chance?
If you had it before, your chance is about 70%.
What?
Wait, if you had it before, you've had a stroke before and recovered.
And
recovered.
It's very likely.
Yes, especially if you don't change anything.
Okay.
Doc, I was asking about, I don't know if I should say risk factors, but what about moods like anger, like getting
emotions
and emotions basically?
Yes.
How does that affect?
So that's psychiatry. If the person is psychiatry based, it means some of the medication the person is taking, that means that the person, even being stressed, can bring on certain conditions. Like because you are stressed, you eat badly. You know, when you are stressed, you eat badly. You don't just stress eating or makes you gain weight and all that.
For some people.
Yeah, for some people, and then you increase your cholesterol level. Which then, so it's a long process, but you get there.
With your sedentary lifestyle,
Add all that to it.
Your depressive activities on Friday and Saturday to compensate.
And not working out as well.
So another risk factor is being black.
Thursday.
So those are higher risk are African Americans, Hispanics, and Native Americans. Those are the 3 groups.
Ish.
Then women.
Is that genetic?
Women are at higher risk of getting stroke than us.
So that means that if you are building it up, you build up from all of the other
everything. So we ask all these questions. Yeah. So we ask all these questions. Yeah.
Are you a woman?
And then the woman will be on top.
Yep.
Wow.
So between the man and a woman, you are at higher risk.
But we tend to see more men.
In men, yes, than women.
So is that the women are stressing them?
No.
Let me ask the doctor.
The modifiable ones is
Let me ask the doctor.
Higher men, yes. So that's what makes us prevalent.
I'm asking a very sensible question. Trust me.
I'm not saying it's a
because going to the market,
women,
when you take a man and a woman, right?
You haven't answered me.
And I'll answer you. If you take a man and a woman, what's the chance of a man going to a gym or a woman going to a gym and looking at a body and say, I want to change it?
The man will go more than the woman.
The woman will focus on her body more than the man, actually.
The woman will go,
to the gym.
Yes. Because socially will make her want to do something about her body.
But the man to go if
I'm not buying it.
If they take do
yes.
if they take do you there.
Your stomach big too, right?
No, if they break up with you.
But no, but
the revenge body. Like a revenge body.
Are okay with it because they will say that their pot bellies mean that they are
money.
rich and they are sugar daddies. So
Lenny, the way you
are.
She's doing the test.
I'm just checking if I have balance.
The issue I'm asking is funny, but it's a very legitimate issue.
Please ask again.
It's true because we see a lot of men
stroke,
having hypertension.
I don't know what image came to your mind when you say stroke.
It's a man.
But I've never even seen a woman with stroke. To be honest,
really,
it's not like.
I have. So
it's not a token thing to say, but like
yeah.
And for many people, I'm sure it might be same. When you think stroke, you think
you see a man in a chair,
blood pressure, he stress, he work, he drink too much, he smoke too much. Wife left farm. It's always guys, and it's always attributed to the hardness. Like when your man never stroke, bet you. No, it's
saying like thing.
No, like I get what you're trying to say. It's an unfortunate statement here. It's unfortunate that people make.
That people make to the
point. A man who falls sick, a man who gets hypertension or gets stroke, is a man who is weak.
Yes,
but sickness is sickness.
And on your bema, you know. Lenny.
You know why? You know why it's like that? Because the way stroke behaves, it doesn't just paralyze the whole body at once. It can take like half.
Yeah.
Okay. So it's sort of like you're slurring speech, your voice, you can't eat on your own, you can't even use the loo on your, like you need really much help and all that support to do everything, most of the things you do. But these days with physio and medication, people are able to recover and come back. I have so many people, even people that I know close to me who had it, like they had the first one, they transitioned with their face, and then they've recovered now.
Wow.
And their face is back to
they're still on physio, not entirely, but they're able to speak clearly for you to understand.
At what point there was no comeback? Is there any sign?
Because this thing can lead to death.
Yeah.
Like no coming back from that. Because that's why you can have a patient who dies and says that the person's alive, the heart is alive, but the brain is dead. Vegetative state.
Okay.
You're basically like a vegetable.
But like let's say your hand is, you can't move your arm or.
That's why with physio, they do a lot of physio. Those guys do a lot of physio, right? Because your muscle, you're trying to. It's like muscle when you're trying to let the muscle remember that it's supposed to move. You know, the massage and everything that they do for it, try to get that memory back. Blood flow to those places, get support to those places to get, because you might not get full power in those hands, but you can get a close as maybe 70%, 80% like be able to eat on your own and all that.
For those who have the very severe forms of stroke, how long can it take for treatment? Treatment
timeline is based on support and the medication, how your body is going to take it.
Okay.
Because we can't tell how much damage how long you've been off oxygen, how much brain damage you've had due to the supply of blood.
It's an individual healing process.
It's an individual healing process. Okay. So you can't really give a timeline. You can estimate and say 6 months. With physio and blah, 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 you should be able to gain this kind of power in your arms, you get a bit of mobility in it. But we can't tell you that for a state like fact that this is going to happen. No. Okay. We see it as a way to empower you. That you keep, because it's difficult knowing that you're able to do all these things before and now you can't. Yeah. And also the pressure we talk about is not only on the patient, it's also on the family, the support system. Because it means that somebody has to be a caregiver. Somebody has to stop whatever they are doing, whatever their life, and take care of the person. Or you have to pay somebody else to come and do it. So that you have people paying nurses to come in and stay in nurses to take care of the patients and their medication and taking them to their labs and their physios. And all. It's not small cost. That's why if it's modifiable, change it now. I feel like these days, anybody at all should be able to walk into a pharmacy and check your blood pressure. Check your blood pressure, check your weight.
That can be an indication of...
Yes.
Okay.
Because you think your blood pressure at 140 is okay. It's not okay. Right. It's not okay at all. You're getting some headaches, you're getting some dizziness, and it comes and goes, and you feel like somebody come in there and say, I said, misogyny. I said, no. Those things are not normal.
Yeah.
It's better for you to, I always say this here, that it's better for you to go to hospital and be cleared than to sit idle for the day for it to get worse and you be taking everything that is worse.
People are scared because ignorance is bliss. When they go and check,
ignorance is bliss, but ignorance is expensive.
Ignorance is
more.
It is expensive. It is expensive.
Okay.
Ignorance is bliss.
That's what you're providing.
It's expensive.
I said that someone sitting beside doc doesn't like hospital. So if they know that ignorance is expensive, then it's fine. Doc.
Now I get it.
But let me have been to the hospital. I went.
You're not living by your words.
No, but as it happened, I go.
What is going on?
As it happened, because I don't like going to the hospital.
Oh, it's you I was talking about.
Yes, I know. I don't like. That's why I said, who is Lenny talking about? Because me, I don't like going to the hospital. Okay. Not because I don't think that going to the hospital is a good thing. It's just because.
The aura.
Charlie,
the aura of the place.
Yeah, like when I go to the hospital, I just
I don't panic at the car park.
They wanted me to stay overnight. I told the doctor that I'm going. I cannot stay. Like I can't.
Which is not a good thing.
No, I hope he made you sign something that you're on your own. You cleared yourself.
Doc, are there some foods as well that can help? Also because you mentioned lifestyle and then lifestyle changes after you've been diagnosed and then you're trying to treat yourself. So beyond the physio, the medication, what are certain foods that we can also take, for those who have stroke, to make sure that they are in tip-top shape and then they don't go back having a stroke?
So we can start from a healthy plate in the sense that because it's a precursor of hyperlipidemia, like high cholesterol levels. You can start reducing your cholesterol level by taking certain fruits and vegetables that are anti-cholesterol. They bind to cholesterol, like fruit that contain vitamin C.
Okay.
Right? They bind to cholesterol when you take them, and then they try to get rid of it through your urine. So your greens, you come back to your greens, you come back to your more of the plant-based proteins.
Okay.
You go to your plant like the beans, the cowpeas, then you go back to fiber diets, brown rice, which people say brown rice. Brown rice.
Again.
Yeah. So our local rice is really better word, unpolished rice is good. Semolina is also not bad. It's gentle on the stomach, but helps you. Yeah. So your diet has changed from the high, because people think that it's only cholesterol. Like you can only get from eating fatty foods, but you can actually get all these things from eating carbohydrates. Yes, because when you eat carbohydrates, your body is supposed to burn it to produce energy. Yes.
Yeah.
Let's say you're supposed to do a work that requires 50% energy. You eat food that's about 70% energy. What happens to the other 20%? Your body stores it in your liver and stores it in your. If you can't, the liver is full, it goes to store it under your skin.
Okay.
Right. So that's why when you do intermittent fasting, you're fasting. When your body breaks down, there's no fat anymore. It goes to your liver stores to get it to produce energy. It breaks down that same fat that's in your liver for energy. If it goes, then liver is like, I'm done. There's no more here. it goes to your skin to get from there. You see how it graduates?
Yeah.
So if you want to really burn fat, that's the process you go through. You try to trigger that mechanism that makes it your body burn the fat that is on your body. Right?
Yeah.
So all these go into increasing your.
So doc, basically live a healthy lifestyle as much as you can.
No, I feel I was saying to somebody that the person asked me how much exercise should I do in a week? I said 70 minutes.
In a week?
In a week. If you can't at all, 70 minutes.
So you can
do
even
something
break that
cardio
down to like 10 minutes every day.
Exactly. You can do a cardio. Right? Let's do 10 minutes a day. In the morning you wake up, you can jog on the spot. Jog on the spot for about 5 minutes, do some push-ups, do some pull-ups, do some squats. Take a shower.
Yeah.
Turn into it's a routine for me, actually.
And for the married people to an active sex life is that cardio. Can fix that cardio.
But do the real cardio.
For the married people.
Oh, it depends on your relationship.
Yes, for the married people. Let's just stress on
for the
married people, yes.
For the married
people, please.
If you are married,
if you are dating, you are not married, you are still single.
Very much.
If you are dating, you are single. Yeah, you don't on the form. There's only two. Either you are married or you are single.
Sex should be between married people.
Yes, it is. It should be. It's not the one that there's regret. You see, there's no regret.
Who said?
What? Pick a side. Pick a side, please.
I don't like how you unmarried people are assuming recklessly.
We are sorry.
We are sorry. So tell us. Wait, there's regret. There's no regret.
There's regret everywhere in life.
But it's your partner.
But that doesn't mean that you things are perfect.
But doc said do actual cardio.
And I'm saying that no, but an active sex life keeps you fresh in the morning.
Okay.
Nothing.
We'll note that for when we marry.
Yes.
But some of your listeners are married people, and they don't have time to wake up in that same morning and go to gym.
Four of us here are single and not married. No, 4 of us here are unmarried. So
congrats to you.
Wow, that's interesting.
Wow.
For later, when we marry, we remember that
bachelorette.
Just here wasting your life.
What?
That's an interesting start too. 5 people who are not married.
We take data. We take statistics of the whole 3 music.
Yes, but 5 people here having sex.
No.
5 sexually active.
What an assumption.
Why assuming?
Plenty things like this one.
I like the fact that everybody can see your faces in HD. What an assumption. Pick them one.
What an assumption. Such an assumption.
There's such an assumption. Because you are just the thing at time. Why you are just the thing? Why don't they hear me well?
Talk for yourself.
So our key takeaway from today is that understanding what stroke is, and that understanding the warning signs, understanding that it's important to act quickly. Please.
Literally be fast.
Like be fast. Literally. It stands for itself. Be fast. Because you don't want to be given that. I tell everybody, you don't want to be in that position that they tell you that should we pull the plug.
Oh, goodness.
The silence. Is that the extreme case of the brain bleed? When that
yes,
happens,
because the person is brain dead.
Irreparable damage.
Irreparable. Like the person goes into coma. So you are praying, it comes back. They don't come back, or they come back and then
all sorts of issues.
Yeah. But the coma can be for years, right? Because I heard a story.
You remember the king, the prince?
The prince.
Yeah.
He's still in coma. It's been 2 decades at this point. Yeah.
The most interaction he's had is finger movement, I think.
That's crazy.
Yeah.
But anyway.
Which could just be muscle impulse.
Muscle impulse.
Yeah.
Wow.
But as long as I pinch you and stuff and you can't feel it, I'll do it. That's
it.
It's not like Ant-Man stuck in the quantum realm, man.
No.
Anyway, thank you, Doc.
Did you just do a Marvel thing?
Time check 10:03. So it's time to go. But the full conversation you can find on our YouTube 3 Music Networks, and then of course across our socials. Papa. Me no beche.
Beneficial.
You guy be on my wiper, major wiper ma.
Tinted. Me pay. Tinted.
Is it a windscreen?
Why? It's lower.
Because these days you see Tom issue a fog members.
And no one now be wiper no pay. Anything.
Okay. Cyril is officially back.
Officially back. Yamin shout for the wiper. I'll be waiting. Okay, Doc, thank you so much for this conversation on stroke. Guys, catch the full one on our socials, on our YouTube specifically, and then snippets across our socials, and then stay interactive with us on our socials as well. And this is also a reminder, if you want a British degree at a fraction of the course, if you're looking for a vibrant student experience in a community that builds your confidence and equips you with real-world employability skills, then Lancaster University is the place to go. Enjoy all these and more with scholarships available to also support your education and academic journey. You also get to be taught by expert faculty trained to UK standards right here on our campuses in Ghana. For more information, you can visit www.lancaster.edu.gh. You can also contact us via email, admissions@lancaster.edu.gh, or you can call 0248 656 274. Lancaster University, Ghana, the only British university campus in West Africa. Oh, I just remembered that I said we were going to have Jeff Eyeglass in here to do a proper birthday wish for him. But yes, happy birthday to Jeff. He's popularly known as Eyeglass. He is a social media executive right here at 3 Music Networks, and your dedication is appreciated. Doc thanks once again. This has been the Culture Daily Morning Show. My name is Lenny Lomote, and I've been doing this with Jason LA Kojo Trip, and the man Cyril Fresh and Cutie is back. Guys, have a good day, and we are catching you at 7 a.m. tomorrow. Don't miss it. Enjoy the rest of our program. Bye.